Good day, everyone. For today's topic, we will talk about pericarditis. Are you ready to learn? Good. Let's get started. In the human body, the heart is the muscular pump that provides pressure necessary to propel the blood throughout the body. It must continue its cycle of contraction and relaxation. Otherwise, blood will stop flowing and cells in the body will be unable to obtain nutrients from food sources and get rid of waste such as carbon dioxide and other products. So let's talk about pericarditis. First, pericarditis refers to an inflammation of the pericardium, which is the membranous sac enveloping the heart. Pericardium is the outermost layer of the heart, which is responsible for the protection of the heart. Next, inflammation causes fluid buildup. What happens when we have pericarditis is that will be inflammation in that pericardial space and fluid will start to build up. The last one, life-threatening concern is tamponade. The increased fluid volume may limit cardiac filling, leading to low cardiac output and sometimes life-threatening circulatory shock, known as cardiac tamponade. The rate which fluid accumulates is often more critical than the volume of fluid. Take note, always remember that infections, heart attacks, trauma, cancer, and autoimmune disorders can all cause pericarditis, which may be acute short-term, chronic long-term. Pericarditis may be acute, chronic, or recurring. The most common form is acute pericarditis, meaning symptoms develop suddenly but do not last long. Subacute and chronic forms develop more slowly and last longer. Recurrent pericarditis is when there are symptoms-free intervals in between episodes. Example, pericarditis may occur after pericardiectomy, opening of the pericardium, following cardiac surgery. Next is pericarditis also may occur 10 days to 2 months after acute myocardial infarction called Dressler syndrome. The main types of pericarditis. First, we have viral pericarditis. Viruses are the most common use of pericarditis. For example, a viral chest infection can lead to a pericarditis. Viral pericarditis has no specific medication treatment and usually goes away by itself. Medicines may be given to help with the inflammation and symptoms. Next, bacterial pericarditis. This condition is potentially fatal without prompt medical treatment. Most cases of bacterial pericarditis are triggered by infections somewhere in the body. For example, a person with pneumonia, lung infection, may be vulnerable to bacterial pericarditis if the bacteria access the pericardium directly or via bloodstream. Next, constrictive pericarditis. As the pericardium recovers from injury or inflammation, scar tissue may form. Scar tissue makes the pericardium stiff and hard so that the heart is unable to fill properly with blood. Symptoms include unexplained weight loss, fatigue, breathlessness, swelling of the abdomen, and the heart murmurs. Without treatment, constrictive pericarditis can lead to a range of complications including irregular heartbeat, heart failure, and liver damage. Next, Post-heart attack pericarditis. While pericarditis doesn't cause or contribute to heart attack, the injury to cardiac tissue caused by a heart attack can sometimes lead to pericarditis. This is known as a post-myocardial infarction, post-MI pericarditis. The symptoms may not appear for some weeks or months after the heart attack and can include relatively mild chest pain, joints pain, and fever. The last one, chronic effusive pericarditis. Long-term inflammation causes a gradual build-up of fluid within the two layers of the pericardium. In most cases, the reasons for this are unknown. Two of known causes of chronic effusive pericarditis are tuberculosis and hypothyroidism. Signs and symptoms. Chest pain. Most characteristic symptoms of pericarditis is chest pain, which can be sharp or dull. Pain may radiate to the left shoulder or arm, similar to the heart attack or ischemia. Unlike ischemic pain, however, pericardial pain is worsened with deep breathing, coughing, swallowing, or lying flat, and can be improved with sitting up or leaning forward. Next, fever, creaky or scratchy friction rub here. This is mostly clearly at the left lower sternal border. Anemia, increased WBC count, non-productive cough, dyspnea, heart rate may increase, and last is weakness. Causes, idiopathic or non-specific causes. This is often unknown. Infection, such as respiratory infections like influenza or gastrointestinal viruses, are common causes. And also infections from bacteria such as tuberculosis, fungi, and parasites can also cause pericarditis. Disorders of connective tissue. Kinds of disorders are systematic lupus erythematosus, rheumatic fever, rheumatoid arthritis, and polyarthritis, and scleroderma. Hypersensitivity states. This means immune reactions, medication reactions, and serum sickness. Disorders of adjacent structures. Kind of disorders, myocardial infarction, dissecting aneurysm, pleural and pulmonary diseases. Neoplastic disease. The reason is caused by metastasis from lung or breast cancer, leukemia, and primary neoplasms. Radiation therapy of the chest. Trauma. This includes chest injury, cardiac surgery, cardiac catheterization, implantation of pacemaker, or implantable cardioverter defibrillator. Kidney injury, and uremia. Complications. Pericarditis may result serious complications. This includes cardiac tamponade, abscess, spread of infection, and chronic constrictive pericarditis. Let's start. Cardiac tamponade is considered a medical emergency and if left untreated, can quickly become fatal. It develops when too much fluids builds up between the heart muscle, which is myocardium, and the pericardium. This puts pressure on the heart that prevents it from both filling and pumping and leads to shock. Cardiac tamponade can cause numerous symptoms, including anxiety, breathing problems and chest pain, dizziness and fainting, swelling of abdomen, drowsiness, weak pulse, and lastly is shock, a condition in which your vital organs, which is brain, kidneys, bowels, and liver, do not have sufficient blood flow to function normally. Next, abscess, a build-up of pus either within the heart or in the pericardium. Next, spread of infection. As with any infection, the infection can spread to the other areas. The last one, Chronic constructive pericarditis, a long-term, rare disease. Chronic constructive pericarditis may also be life-threatening if left untreated. It slowly develops when pericarditis causes scar-like fibrous tissue to form on the pericardium, making the sac thick, stiff, and rigid. Scarred tissue contracts over time, preventing the heart from fully stretching and filling with blood. Chronic constructive pericarditis can cause symptoms including weakness, fatigue, difficulty breathing, and last swelling in the abdomen and extremities. Diagnosis: pericarditis is diagnosed using a number of tests including medical history, physical examination, including listening to the heart through a stethoscope. The inflamed can be heard in pericardium layers rubbing against each other. Electrocardiogram (ECG) is a useful, simple tool that may aid in the diagnosis of acute pericarditis. Typical ECG findings include diffuse concave upward, ST segment elevation, and occasionally PR segment depression. Chest X-ray is not helpful in uncomplicated pericarditis. A chest X-ray is usually normal. However, if fluid accumulates in the pericardial sac, the heart can appear larger on the X-ray. Echocardiogram to see how well your heart is working and check for fluid or pericardial effusion around the heart. An echo will show the classic signs of constrictive pericarditis, including a stiff or thick pericardium that constrict the heart's normal movement. Magnetic resonance imaging (MRI) is ideally suited for evaluation of small or loculated pericardial effusions, pericardial inflammations, and functional abnormalities. This caused by pericardial constriction and for characterization of pericardial masses. Blood test. Laboratory studies are useful for excluding other possible causes of symptoms and clarifying the underlying cause of pericarditis. Testing is individualized but frequently includes a complete blood cell count. Blood tests can be used to make sure you are not having a heart attack, to see how well your heart is working, testing the fluid in the pericardium, and help find the cause of pericarditis. A sample of pericardium fluid may be drawn off with a fine needle and examined in a laboratory. Treatments. For medications, treatments for pericarditis depends on the cause and severity of your symptoms. Mild pericarditis may get better without treatment. First, we have pain relievers. Pericarditis pain can usually be treated with over-the-counter pain relievers, such as aspirin or ibuprofen, like Advil, Motrin IV, and others. Prescription strength pain relievers also may be used. The next one, colchicine. This drug reduces the inflammation in the body. It used to treat acute pericarditis or if your symptoms tend to come back. You should not take this drug if you have liver or kidney disease. Colchicine can also interfere with other drugs. The physician will carefully check the health history of the patient before prescribing colchicine. The last medication, corticosteroids. Corticosteroids are strong medications that fight inflammation. The physician may prescribe a corticosteroid such as prednisone if your symptoms don't get better with other medications or if your symptoms keep returning. Take note, if your pericarditis is caused by a bacterial infection, you'll be treated with antibiotics and drainage if necessary. Surgeries and other procedures. If pericarditis causes fluid buildup around the heart, you may need drainage or surgery. Treatments include pericardiocentesis. In this procedure, a physician uses a sterile needle or a small tube catheter to remove and drain the excess fluid from the pericardial cavity. You'll receive a numbing medication like local anesthetic before the procedure. Last, pericardiectomy. This surgery removes the entire pericardium. It may be done if the sac surrounding your heart has become permanently rigid due to constrictive pericarditis. Thank you for listening. I hope you have learned a lot about pericarditis. That's all for today. Padayon future nurses!